Hello, everybody. This is Dr. Abdullah. This is May 1st, 2000 and, 2020. And I am talking today. I'm doing another Ask Dr. Abdullah Anything. It doesn't have to be. I usually would do this with coronavirus, but you don't have to just do coronavirus. And if you have any questions, feel free to ask. Let's see now. I'm going to. Okay, let's see. Let's see. I'm just trying to see if there is. Let's see. If there's anyone out there. Let's see. Ask. Let's see. Oops. Okay, I'm just trying to copy and paste this. There we go. So let's see. So let me switch screens so that everyone can see. All right, let's see. So today we can see there are 3,321,000 cases, and there's unfortunately been 273,000 deaths. And if we look at the daily increases in number, there is still essentially a flat. Well, the number of cases are not dropping; they're about the same. There's maybe a very minor negative trend to the daily number of cases. What we would like to see is this near zero, but that's going to take a long time for the whole world, and each country is different. The United States has the greatest amounts of numbers. They have over 1,091,000, and their number of cases, the number of deaths, unfortunately, has been now 64,000, and their trend is also trending down. Let's see, is there any questions? Oh, there's a question. There's someone watching. If anyone's watching, please ask questions. I'm here always to ask questions. And don't be shy. So, let's see. So, if we look at Spain, we can see that Spain numbers are also dropping, are trending down. I think Spain will have this conquered soon, maybe by middle of May, which is actually very good for Spain. Italy is also dropping day by day. So their hard work and diligence is now beginning to pay off. The United Kingdom is also trending down slightly. France is also trending down. Germany is really doing well. Almost by May, I would imagine this will be done. Turkey is also trending down. Maybe by June for Turkey. Now for Russia, Russia is just going up and up and up, and is not controlled in Russia. The Russians, I think, are like the next U.S. They're just not. They just. I don't know what the leadership is doing there. Iran is. I don't know if that's true or not. Brazil is just like Russia, just going up and up and up. Is there any question? No, not doing a question right now. Now, China is. I don't know what China is doing, but let's see. Canada is beginning to. It looks like their numbers are about 1,700 new cases per day, but their trend is about plateauing. Maybe if you look at right here, it's trending down, but that's not looking the whole grand scheme of things. Belgium is trending down. Peru is just like Brazil. So I think this is really affecting the South American countries a lot. The Netherlands are falling significantly. India is just exponentially growing. Um, let's see. Switzerland is almost gone. And let's see. Saudi Arabia is just I don't know, just going higher and higher and higher. Sweden is Sweden is it doesn't have that many number of cases, but they're actually going up. And they Ireland is falling, and let's see, Mexico is also trending up, just like South America. Pakistan, like India, is trending up, and let's see, Israel's trending down. Austria is basically conquered the virus at only 50 a day. That's really good. Belarus, Qatar, Japan is really dropping it significantly. Poland, United Arab Emirates. I would say largely the Arab world and Asia in general is not doing well, except for maybe Australia, of course, and South Korea. Africa, I would imagine, is the same, and South America is just the same thing. The United States is beginning to control Canada is more along the way than the U.S. and Europe will be likely the first one to really, as a continent, cure this issue or control this issue. Let's see if there's any questions. Let's see. Okay. Now, if anyone has any kind of question, let's see. I was also thinking, I was going to stop here for a second, but I was thinking if anyone wants to talk about any kind of other topics. If I was thinking maybe you'd do, if the viewer out there, I'm not sure if he or she can say anything. I'll just say hello. Hello there, viewer. I'll keep doing this. Hopefully, eventually, people will begin to see that there's content. It's a little bit hard to just do ad lib, but let's see. I guess what I could talk about is one thing is, what do I do as well? So let me go to my website. So I'll sort of do that. So I am located in the Bay Area, in San Jose, and let's see, is there a picture of me somewhere? I think there's a picture of me down here. There I am. Yeah. So I'm on YouTube, of course, and then I do a daily Q&A, or actually weekday Q&A, and there's a variety of tools that I have on my website if you want to use it. Let's see if there's any question. Oh wait, hello. Oh, hello. Hello, Vidya. So, hi. If you have any questions, you can ask. Really not. Oh, thank you. You're welcome. Thank you. It's day by day. It gets lonely here, but it's okay. I only do this for a little bit, then I go back to work. I'm also a hospice medical director and a home health medical director. And if if you have any questions about that, I can talk about that. But that can sound a little bit morbid and gruesome at times. But variety of services I can do. I can treat insomnia, arthritis, asthma. These are just whatever medical issues. IUD, urgent care, diabetes, EKG machines, spirometer. I sort of use that off and on. I can do this for various people where I test for alopecia. Or not test, but actually treat it. That's basically when there's like this balding spot on somebody's head. This is actually from I think this is like a 19-year-old girl. So she had this big balding spot, and I treated her with steroid, and we were able to return a lot of her hair back. And then these are the various insurance groups. Although I'm not sure why United Health is there. That should not be there. But I also have, let's see, patient resources. This should have like some YouTube topics that I have that I discuss. And let's see, what else? And then there's whatever, testimonials. These are just people just talking. But services, and then we talked about that. And let's see, is there, We used to visit. Oh, really? Hello. I think I do. You have a question? Please ask. Um, yes, I remember Varun. Yes. Uh, but if you have a question, please feel free to ask. Um, but I could also talk about, let's see, hospice as well. Oh, what is this? This is just the coronavirus issue. So I'm a medical director of hospice. So you may be wondering, what is hospice? So basically, hospice is this. It's a transition care between when someone is very gravely ill and no longer wants active treatment and just wants comfort care. So hospice is there to bridge that gap in pain, in medicine. So my job is to determine if someone is eligible for hospice under Medicare guidelines, and then we give a variety of services. Now you don't have to stay in hospice; you can always come off of hospice. So it's not like, oh, once you're on hospice, God forbid, it's a death sentence. No, it's just there as a comfort measure. Let's see if there's any question. No. So I'm also medical director for home health. So home health. So there's a company that I work with. I can work with a variety of companies. Like, actually, I've worked with them before. But I'm also medical director of something called Bridge Home Health. Home health is basically it's like a rehab at home, sort of. So if you go home and you need further nursing care or medical care or occupational therapy or physical therapy, home health covers that need. So let's see. So I'm there as well. And then, of course, I treat a variety of other ailments. I'm also on Twitter. Here, let me see if I can show you my Twitter page. Twitter. If you want, you can. There's a way of. Let's see. Aha, there I am somewhere. Well, there I am. No, that's where's my main page? Maybe this is it. Aha, there I am. So that's my Twitter page. I sort of used it, not really. I've had it since 2013, ever since I joined John Hopkins, yeah. So let's see what else. Then of course I have also. Oh, let's see. Sometimes my belly button pains, like very mild, kind of odd smell. Not sure why. Well, belly buttons actually. I have belly buttons can has a variety of issues. Now you have to remember, a belly button is a virtual space. So let me change views here for a second. So a belly button is essentially, if you think about it, here. Actually, you know what? Let me show you anatomically what is a belly button. Actually, we call it the umbilicus. Okay, that's what we call it. Let me show you. Let me change views here and show you what is the umbilicus. There we go. So there's umbilicus, and let me show you if there's an image of the umbilicus. It's a belly button. That's what we call the belly button. And there are a variety of different belly buttons, innies, outies, innies, and all sorts of things. And essentially what a belly button is, it was the remnant of the artery and vein that we shared between mom. It's the umbilical cord, it's the attachment, and most people would know that. So there's also another thing. This is also so it's part of the abdominal wall. So if you look at the abdominal wall, it's actually a weak point. It's not actually as strong as the rest of the muscle wall. So sometimes if there's a hernia, God forbid, you can have umbilical hernia. So what would that look like? A hernia from that. I'm not saying that's what this is, but I'm just showing you. So there is a hernia for an umbilicus. That's basically when the intestine can sort of pop out that weak spot. That's what an umbilical hernia is. Now, it could also be, if there's pain, it could also be just simply, there could be something growing inside. Just like sometimes you can have odd bacteria smell in there. So one thing you could do is you could treat this with this medicine, if you want. It's called Hiboclens. It's not really a medicine. Hiboclens, where is it? There it is. So Hiboclens is something that I prescribe people. Well, I don't prescribe it. I tell people about it, and it's what dermatologists use. It's chlorhexidine. It's basically the surgical scrub that we give before we do surgery, and it's you're supposed to you can use it if you wish. You don't have to use it daily, but you can, if there's a weird and odd smell, you can use this medicine called Hiboclens. It's at any Walmart. See, Walmart has it, or Target. You don't, or Walgreens. Doesn't matter where you get it, but you put in a little bit of this stuff into the belly button, and sort of like a soap, just a little bit, and then you wash it out, and then that's it. You can do it daily, and if there's any kind of bacterial infection or what have you, you can treat it with a Hiboclens. I have a patient who has infectious like boils all over his body, and I've been treating him with antibiotics and also Hiboclens, and it's his boils are beginning to go away. So this can help clean any kind of topical bacterial infection. So if you want, you could try Hiboclens to get rid of this, especially when you said odd smell. So you could treat that odd smell with Hiboclens. But yeah, so this is if that's the case. I doubt you have an umbilical hernia. It's rare to have those kind of things. Let me see if I can go back to it. Does it go back? Yep. Well, there's no. Oh, okay, yeah. But an umbilical hernia or abdominal hernia itself. So abdominal. Oop. There we go. No, I don't want that. Well, you can have that too for women. But an abdominal hernia you can have all over the places. You can have umbilical hernias, epigastric hernias, incisional hernias from the cervical inside, femoral hernias, direct inguinal hernias, indirect inguinal hernias, and men usually have these ones right here, these two. Men and women can have this one. The reason men can have this is because when we develop as babies, men have their testicles are way inside their body wall, and what happens is the testosterone that is developed from the Y chromosome. The Y chromosome codes for testosterone, and when men produce more testosterone, it causes the testes to descend through the abdomen into the testes. And what it does is it actually goes through the body and goes through the inguinal canal. So there's a little bit of anatomy. But the inguinal canal is this thing right here. It's not a good image of the inguinal canal. Here's a better one. But you can see that this is the spermatocord right here. So there, like anytime there's kind of like a weak spot in the abdomen. So again, like I said, there is a weak spot in the belly button, but there can also be a weak spot here where the arteries and veins for the legs are going through, and also right here for where the spermatocord is also coming out. So spermatocord is basically right here. There's another view of it, but I think that was a better view. Here's another view. So here's the testes, see? It's descending through, and you can have a hernia here, or a hernia right here, or a hernia right here. So, but that's only men. Men, of course, only have these issues. So, let's see. But yeah, Hiboclens is a great medicine. Over the counter, you don't have to buy it. Well, you have to buy it, I'm sorry. But you don't need a prescription. I don't prescribe this stuff for you. This is what dermatologists use all the time. Or when we do surgery, we'll give you Hiboclens. But yeah, there's all sorts of hernias, unfortunately. But I've actually been involved in some surgical repairs as a medical student of these things. This is one of the most common surgical repairs done in general surgery. It's not scary. Here's another view. This is basically where an outpocketing of the hernia is happening. And this is what a hernia is. So you can have two kinds of hernias. You can have a reducible hernia would mean basically fancy word for reducible is I can take this intestine and stick it back inside the tummy, inside the abdomen, and that's reducible. Non-reducible are things that are incarcerate, incarcerated is basically the hernia will not go, or the intestine will not go back inside. Now that can be okay, but the real danger is if there's a twist. Does that show the twist? That's called an that's called a restricted or constricted hernia, and that needs to be surgically repaired. Here's another example of an inguinal hernia. So this is important. This needs to be treated because, well, poop is going through here, right? And if poop opens, if this busts up, right? Well, you have to have poo, right? And your poo only goes through one chute. So if this gets trapped inside there, well, you're not going to be pooing anytime soon. And trust me, that's an infection waiting to happen. So this is the Department of Surgery and what have you. Let's see. Is there any other questions? Oh yeah, it's at CVS. Yeah, you can get at CVS. And I see there's 2-3 more viewers out there. Of course, remember, you can ask me any question right here on the side. I'm a faster word talker than I am a typer, but yeah, I do this from 12:30 to 1 o'clock usually, and I'll go over a little bit if anyone's asking any kind of questions. Usually I've been talking about the COVID-19 issue, but there's only so much you can talk about COVID-19. I was also thinking of doing maybe any kind of like I've done these medical topics for a radio show that I did a while back. I can do those topics about high blood pressure, cholesterol, diabetes, or I could also talk about. I was thinking about talking about even like the claims, the medical claims that makeup companies make up. So like makeup companies like oil of Olay. Yeah. Olay. They have all these nonsensical things of, oh, you do this and your skin will be regenerated and all that nonsense. I actually want to at one point make a video where I talk about where do they come up with this stuff, like this Regenivist or whatever it is, oil of Olay, Regenivist or whatever, microsculpting. Frankly, I think a lot of this is nonsense, but I'm a guy too, so I think the only good thing about it is because it's a sunscreen. That's the only good thing about any of this stuff. I can go into the pathophysiology of the skin, so I'm thinking about that. But I also have an Instagram if anyone wants to see. I think it's I don't know where it is. I have to. There's no way of showing it really. But if you have questions, you can always ask me. Vidya asked me questions, so I'm try to answer as much as I can. Yeah, there's like all sorts of things people say. Like if we go to this all of Olay, let's see, if we go to the website for it, that's a shop for it, but like here, this right here, it's saying here, best moisturizer comes in a little red jar, la-di-da, skin benefits. The red jar is known as their go-to non-negotiable face moisturizer for over 50 million jars sold, la-di-da, da-da-da. Infused with vitamin B3, amino peptides, hyaluronic acid, antioxidants, and ultimate penetration, moisture binding formula. B3 not only helps. A lot of this stuff is just mumbo jumbo, frankly. I like the skin is. A lot of this is marketing. It makes it sound important by putting these buzzwords of vitamin B3, amino peptides. So I've studied I have a microbiology major as an undergraduate, and I had also minored in chemistry, and I still remember all the 20 amino acids by their like structural figures. Amino peptides is the most idiotic name I have ever heard in my entire life. It's stupid. So I don't know what to tell you. What the heck? It's like so a protein is made of an amino acid. An amino acid chain is a peptide. It's like a nonsensical term. Hyaluronic acid, yeah, we do have hyaluronic acid in our skin, but I'm gonna go into this and just talk about this is right here. These these just putting these, oh, it's so medically beneficial and all that nonsense. Frankly, what you need to do is don't go in the sun as much. Sure, you can moisturize, but you can get a lot of that. You can. I don't think you have to buy expensive moisturizing cream, but also I'm a man, so I've got my man bias out there too. But a lot of this stuff like Skin Advisor. Oh yeah, Skin Advisor. You know, what is the skin age analyze? Frankly, don't go in the sun. Here's a pro tip. Don't go in the sun as much. Protect yourself from the sun and don't get a sunburn. And here's another thing: we age. We're human beings. We get older. It's just the way we are. Um, so my wife is shaking her head. She's looking and just shaking her head. Uh, but that's my man bias as well too. So, but maybe I'll make a video and maybe people will trash me about my views about medicine, about olive oil and all these nonsensical things of serums and retinol and oh yeah, serum, deep penetrating serum. I really love to see what they never mention what science or what kind of studies that they clinical studies and then they just bury it there. What clinical studies? Okay, if you're really if you're really going to be there for clinical studies, give us the clinical studies. Do I have to literally look them up myself? like um there's a lot of, I think, hooey out there, so, especially with these makeup companies. And maybe this is a way of contact. My wife is saying no, there's no hooey. She's shaking her head. Well, we'll see if there's any hooey, but um, I think let me change views here. So I don't know. I think I'm gonna make some of these kind of videos where I talk about this. Maybe people will also be interested in that, where I will take literally a physician's point of view of all these medicines. And she's laughing. Oh, so we'll see. I think that this stuff is there's some benefit, but to large of it, like, I just think there's how many ways some guy or some lady was in a makeup company and said, how many ways can I sell snake oil to women? Oh, I can call it serum, I can call it this, I can call it that. Oh, let's see. Oh Lord, somebody's calling me. What am they getting? Oh, okay. Well, I've got other prior duties that are coming up. Apparently, something's happening. Okay. Well, I'll see you guys next Monday. All right. Thanks. Bye bye.